Hi, welcome to the Pinoy RN, a podcast that provides insight into a variety of subjects relevant to Pinoy nurses. Here's your host, Jerome Babate.
That is a good question to start with because a lot of people ask me, how did I come to the U.S. practicing what I love to practice? So a little bit of background there because I didn't always start as a nurse. I was a chemical engineer in the beginning of my my career. But I worked in different roles back in the Philippines as a visiting professor, both in various universities. I teach classes in literature because I have a background in literature, social sciences, and then I also teach in chemistry, mathematics, and engineering. So from that background, I became interested with trainings all over the country, and I was trained at the Development Academy of the Philippines to do seminars and trainings, and granting me the accreditation of the National Accreditation for Trainers of the Civil Service Commission. So from that stint, I became one of the trainers that develops modules and programs for the government employees and government agencies. So we conduct all over the country seminars. But I was also a full-time employee of the National Power Corporation. I was assigned as a technical assistant for over 10 years. And what I do was I was assigned in contracts and expansion projects and fuel management. But I was more interested in training. So after 10 years of that experience, I was interested in exploring some more. I was traveling all over the place, but I really wanted to explore training. But because my background was engineering, I thought that public administration would be a good stint for me. And so I went into that background. But at that time, I was already traveling in the UK and in 7 countries of the Middle East. So I was the training and certification engineer. I traversed about 7 countries in the Gulf Cooperation Council, and also the UK, London, and northern Scotland. So from that, I gained more experience in conducting trainings and certifications, but I'm really interested more in dealing with not machines and processes, but people. I went back to the Philippines, studied nursing, became a nurse, and worked straight to the operating room. And from then on, some companies recruited me in the US, and I went and started my career as a travel nurse in the operating room and started training. And then my career just took off. And from there, I had several roles in the operating room. I became a nurse leader. I became a nurse manager in the OR. I became a training manager, and I became a director in training. And those are all good experiences, giving me backgrounds. But then again, my heart is always crying for training to become an educator, to be the person that will develop something that will be more valuable, to create value to my audience. So I left all those opportunities and became an educator. So right now I'm an educator of a large system. We call that the Catholic Health Initiatives. It's a religious faith-based healthcare system, but I am also I am based in one of its hospitals. There are over 174 hospitals all over the country, and I am based in one of the largest hospitals, which is the St. Luke's Medical Center. This is a new role for me because I was from MD Anderson Cancer Center, and when I said I'm going to explore and expand some more, it just opened up. And so I said, okay, I'm going to go for it. So a little bit of background there, because this is really what's going on for me in the US. A little background of the hospital that I work in right now is that this is located in the Texas Medical Center, which is the largest medical center in the world. This hospital is the center. There are other hospitals. There are 65 hospitals in the medical center. And one of the hospitals is the hospital I work for, and that is the St. Luke's Medical Center. All the other 65 hospitals, 64 hospitals in this center are tertiary hospitals, which means that they are third level specialty hospitals. That's why you can easily see a trauma hospital, a cancer center, children's hospital, hospital for women, orthopedics hospital, long-term rehabilitation hospitals, and all those kinds of hospitals. And our hospital is not one of those. Our hospital is sitting on top of everybody. It's a quaternary hospital. What that means is that all the other specialties that all the 64 or so hospitals offer is also offered in this hospital. So you can just imagine the quality, the expectation, and the resources that you need in order to move around. And I'm so happy. Some hospitals have one OR, and some hospitals have about 30 hospitals. Before I come here, I was a manager in a hospital of 10 ORs. But I left the hospital that I was a leader there in the hospital that has about 38 ORs. And then I went to a 56 ORs. This facility that I'm in has 6 OR complexes, which means that there is not just one OR. There are six OR complexes, and one OR complex has about 24 ORs each. So if you imagine that there is a vast amount of people that's coming in and out, and education is foremost. And that brings me into the discussion of this first question, which is that's the background I have, and I came here, and there's a lot of opportunities that's open for me, and it's just never ending, and you can touch people. And I think I would say that I am at the top of my career doing what I love doing, because there's a lot of opportunities to do that here, compared to what I did then as an engineer. And although I traveled for training, it wasn't about touching people's lives and giving value. As an advanced nurse practitioner, I get to work with various different teams in different specialties. Since I work straight from when I became a nurse, I work straight to the OR. The OR is pretty much let's say that's the pond for me. That's where I thrive. And so I practice advanced nursing in that area only. I mean, I could practice pretty much everywhere else, but my heart always brings me there. But that also afforded me handy access to grow professionally from direct patient care, treatment to more evidence-based practices, and also not only practice in direct patient care, but also brings me to management, leadership opportunities, and brushing elbows with corridors of power, if you would like, in the healthcare industry. What that gives me is that it gives me a wider range of marketability as far as my skill sets is concerned, because it's not so much about who do I know or who knows me, but it is so much about whose database I am in. It's like that. Before you go get a job or get that opportunity, do you know those people whom you know? But now it's more than that. It's more like they know me and I know them, but am I in their database for this particular specialty or particular skill set? So that's one thing that gave me that opportunity. And another thing is that there's really no limit as far as progressing in your nursing practice is concerned, because we work with so many different specialties that I'm just one of them that's traversing in that particular journey. So it's good. as a nurse practitioner and working in the U.S. setting, especially that I am based in Texas. Texas is pretty much laid back, but it has all kinds of specialties. I'm not sure about practicing the same scope of practice in the nursing profession in other smaller states, if you may, or in states that don't that has a lot of political anchors to prevent nurse practitioners from expanding their profession. I actually have one of those comments before when they asked me. I think it was in Nebraska, so that's about north. And when we were doing surgery, and they were saying, "So you're a nurse practitioner?" And I said, "Yes, sir." And they would say, "So what do we call you now?" So doctor, nurse. And I said, "Well, you can call me doctor." Because he was a physician. Because do I call you a doctor physician? It's kind of like that conversation. Because if you're a doctor, you're a doctor. But if you're a doctor, you're a doctor. You're a physician, you are a doctor. But you're a nurse practitioner, you're a doctor too. And you are on the same level. You don't call somebody a doctor physician or a doctor nurse practitioner. They are all doctors. You just address them as doctors. There's a great opportunity to teach the community, not just the healthcare industry, but also even the healthcare industry needs to have that understanding, I believe, because over the years, the title of doctor is somehow monopolized to physicians, but the doctor is the title that is afforded to an academic achiever who attains the highest degree of the academic ladder. And in that context, when you reach that the terminal degree is a doctor. So there is a need for us to be able to understand that context, especially also in our patient population, because when you see a patient, you introduce yourself. I'm Dr. Levine, and I'm your nurse practitioner. And what does that mean? And so they don't understand that. But little by little, they would understand that as the profession evolves, because there needs to be a better training and better skill set. But then again, that's the challenge as a nurse practitioner today. How do you practice in that level, but being understood in that context as well? So, I think that's one of the concerns today. And in the conventions that I attend, the discussions are always like that. Oh, I'm sure there are a lot of people who wants to grow into this profession, and I would encourage. I always tell a lot of my students. I teach in the doctoral program in two universities, but I always tell my students, those who are in the basic nursing, which is your ADN and your PSN, and their nurses, and I said, and even those surgical technologists, I always tell them, if you hang out much longer with me, you will become a nurse. But the word of wisdom I always want to share is that we always break barriers. Break those barriers, because those barriers prevent you from being successful in your profession. I'm a nurse. I'm okay with what I'm doing. I just go home and get a paycheck, and that's okay too. But there is a barrier there that you probably didn't see. So what I'm going to say to everyone, just break those barriers. Just go ahead and break those. If you want to work in the operating room, the double doors, which we always call what it is, because usually the operating room is separated with a double door. The double doors appear closed. They appear only closed, but they swing open once you get near them, and they closes when you pass. So do your homework and go in, because it's easy, and you can see those people that work in the operating room. They stay there. There is something in the operating room. There is something in perioperative services that you specialize in. I know there are ICUs, and I worked there for a couple of years. I worked in GU and GI floors, because as a nurse practitioner, I just got to get exposed there. But there's nothing like the operating room. But people are scared because of the knives and surgeons. There is a convergence of different specialties, different personalities in one room. And who are you? You are the nurse in that room. It's kind of like so intimidating. But if you break those down, break them into pieces and get closer, the door will swing open for you. And then opportunities will arrange in front of you, and you can just take them one step at a time. So that's my word of wisdom. Break those barriers. That's a good question. Okay? You make lots of questions here, Jerome. But the next thing for me, okay, so sometimes you are being misunderstood that you are never satisfied because there's always something next. There's always something you want to work for. But really, our mind is a center of divine operation, so to speak. And that divine operation is always for expansion and fuller expression of ourselves. And this means the production of something beyond what has gone before, something that is entirely new, something that is not even included in past experiences. But my heart always says there must be something more. And I know that there is. And as a perioperative educator, I am becoming closer and closer to just become a consultant. And then I would just rest my laurels and then just say, okay, well, I'm a consultant now and I'm just retire. And that's good too. But as I want to enjoy, as an operating room nurse, I was traveling. I was always traveling, and then I stopped because I got a permanent job, which really is a comfortable way to have. And then I started aching for traveling, but not in the sense that I started. So what's next for me is to spend some more, not just to where I am, 174 hospitals, but to the country to share what I have. I always keep telling, I want to share this. I want to keep this with me. I want to be able to see people rising into that role and duplicating myself, because I'm not going to stay here forever. I have projects like the training resorts that I've developed in the Philippines, and that will be my ultimate landing ground for this career. By that time, probably when I grow up enough to just keep sharing what I have gotten myself, that will be the best place for me to do my trainings and seminars and sim lab. There is a sim lab that is also being constructed in that facility, which means that all nurses, aspiring nurses, medical professionals, physical therapists, those who are in the healthcare industries can go and get trained and not worry about how much money do I need to shell out in order to get the training. There are ways to do that, and these ways are not painful for our finances. So I always want that, because when I get to that point, like, I'm so tired of these interviews that Jerome is doing.
Well, that's all for today's episode of Pinoy RN. Thanks for listening, and thank you to our guest for joining me today. Join us again next time when we talk about Filipino nurses and nursing. Make sure you subscribe to the Pinoy RN podcast on YouTube so you never miss an episode. Also follow us on Facebook at Pinoy RN Podcast. Special thanks to our event partners, Beta Nu Delta Nursing Society, Filipino Nursing Diaspora Network, Nursing for Humanity.